Namaste. I'm Dr. VIJITH, Chief Physician and Managing Director of VIAMS. Our vision is to inspire well-being. Our continuous effort to fulfill the vision and social commitment. We propagate Ayurveda-based well-being assurance in the event of Brain Week 2022. I would like to bring your notice in dementia, a brain-related disorder, and will be bringing some lights of dementia management with Ayurveda in VIAMS. VIAMS is a healthcare unit based on Ayurveda with a legacy of 4 generations. Our vision is to inspire well-being, providing 360-degree service provider in healthcare industry. And VIAMS is a destination for Ayurveda-based solutions. Our mission is to reinstate well-being through the hospitals and clinics, sustain well-being with the pharmaceutical division, master well-being with the academy and medical colleges, assure well-being, plantation, and good quality of raw materials for preparing medicinal formulations, and rejuvenate well-being, the wellness. Ayurveda is a complete medical system which perceives that ultimately all intelligence and wisdom flows from one absolute source, that is Paramatma. Health manifests by the grace of the absolute acting through the laws of nature, that is Prakriti. Ayurveda helps nature by promoting harmony between the individual and nature by a life of balance according to her laws. Ayurveda is considered as the wisdom of life. Ayur means life and Veda means wisdom or science. Ayurveda, the holistic science, has been widely practiced and used for centuries and is now accepted and recognized by the World Health Organization. Ayurveda practices in Indian region more than 5,000 years ago and is often called the mother of all healing. Ayurveda believes in 5 basic elements, Pancha Mahabhutas, that is the space, air, fire, water, and earth, which manifest in the human body as a 3 basic humors as Tritoshas, that is the Vata, Pitta, and Kapha. Each person is born with a unique combination of these doshas, which decides their basic constitution called Prakriti. We all have a different balance of energy. Ayurveda shows that the path of the optimal health is different for each person depending upon their body constitution. Now, today's topic, dementia. Dementia is a progressive, irreversible, degenerative disorder of the brain affecting cognitive functions, mainly memory, thinking, judgment, and ability to learn and impaired. Our conception, this institute conceives dementia as Smriti Bhramsha or correlate dementia as Smriti Bhramsha in Ayurveda. Ayurveda envisions the human body as the congregation of 3 basic humors, namely Vata, Pitta, and Kapha, as I mentioned earlier. And the human mind possesses 3 basic qualities, the Mano doshas. Sattva, the pleasure. Rajas symbolizes lust, anger, pride, aversion. And Tamas, indicative of fear, ignorance, inertia, and confusions. According to Ayurveda, Smriti Bhramsha is a disease of mind developed due to provoked vada and also hina sattva, rajas predominant person whose mind has weakened by stressful conditions are more prone to develop smriti bhramsha. Also, increased rajas supports the tamas to develop smriti bhramsha. Vada is the entity concerned mainly with the control and coordination of our body and mind by maintaining all kinds of movements and thought processes. The vitiated Vada vitiates other doshas and thus disturbs the function of Di. Di means the intellect and perception, and Dhridi, the intelligence, and Smriti, the memory. Thus correlates dementia to such an exaggerated condition of Vada called Smriti Bhramsha. Now, the Vada predominating loss of memory, we can take it as Alzheimer's disease, and Pitta predominating loss of memory, we can take it as vascular dementia, and with Kapha predominating loss of memory, we can say it as atherosclerotic dementia. Now, Smriti Bhramsha. Tattvajnani smritirasya rajo moha vridatmana drishyade sasmritir bhramsha smartavyam hi smidhaustidam. If the memory, this is a famous quote in Charaka Samhita, that means if the memory is impaired due to a being overcome by rajas and tamas, it is known as Smriti Bhramsha. Now, how dementia? Before that, the Smriti Bhramsha, the dementia notations in Ayurveda, it is clearly mentioned in Charaka Samhita, Susruta Samhita, Ashtanga Sangraha, Ashtanga Hridaya, Madhavanidanam, Harita Samhita, Chakradatta, Sharangadar Samhita, Bhava Prakasha, Vaishnajaritnavali, etc. Now, let's see how dementia occurs. Well, dementia is caused by damage to loss of nerve cells and their connections in the brain. As I mentioned earlier, there are different types of dementias. That is, mainly it is Alzheimer type, then vascular dementia, then many other neurodegenerative diseases, condition which dementia occur in late stages. That is, in Parkinson's disease, Parkinson's disease later stage, it may develop dementia. Then the underlying cause of this dementia is Lewy bodies. Then Parkinson's plus PSP, progressive supranuclear palsy, CBD, cognitive behavioral disorder. Also, we can see dementia. And chronic inflammatory conditions of the brain may affect the cognitive functions, including multiple sclerosis. Dementia as a feature of other conditions that is mentioned as the chronic inflammatory conditions, sclerosis, then systemic lupus, etc. So, shall I ask you, are we at risk? Certainly not. But yes, let's look into it. Dementia patients over the world will be 30 million in 2008. And in 2030, it will be approximately 59 million. And by 2050, in the year 2050, it will be 104 million. So there will be an increase between 200 and 500% in different regions across the globe. Even though we can control dementia. Now, let's move to the causes. What are the possible causes of dementia? Mainly, we can say it as hereditary, drug-induced, traumatic, chemical interactions, accelerated aging, and obviously other diseases. So let's discuss in detail about the hereditary dementia. Dementia can run in families as a result of faulty genes being passed to a child by their parents. I'll be more specific. Our possibilities are more to have dementia in the case if the patient, parents, grandparents, siblings, or any blood relatives have any type of neurological issues, especially dementia, progressive supranuclear palsy, motor neuron disorders, amyotrophic lateral sclerosis, dystonia, Alzheimer's, mental retarded, etc. And we have an experience in treating 3 generations of dementia. Dementia due to Alzheimer's disease. Alzheimer's disease is a progressive, relentless loss of cognitive function characterized by degeneration of the brain tissue, including the loss of nerve cells. So, starts with forgetting recent events, then can express only simple words or monotonous sound. Eventually, they forget daily activities, and gradually the patient will depend completely. Then the next is Lewy body dementia. Lewy bodies are clumps of protein that can form in the brain responsible for the behavior, movement, and cognitive ability. Abnormal accumulation of Lewy bodies is associated with the loss of certain neurons in the brains that produce 2 important chemicals. That means that is called as neurotransmitters that act as messengers between brain cells. One of these messengers is important for memory and learning. The other, dopamine, plays an important role in behavior, cognition, movement, motivation, sleep, and mood. In turn, can lead to problems with thinking, movement, behavior, and mood. The next is vascular dementia. Abnormal destruction of brain tissues by stroke due to destruction of the brain tissues by series of the strokes. Then the next is drug induced by long-term drug usages for depression, anxieties, or gut-related problems. That also may leads to dementia. Then infections such as AIDS, alcohol abuses, low thyroid function, pre-diabetic or metabolic syndromes, deficiencies in vitamin B, especially vitamin B12, high cholesterol, omega-3 fat deficiencies, radiation therapy to the head as treatment for cancer, that late radiation damage. Then chemical interactions, mercury or heavy metal toxicity, that also may lead to dementia. Then accelerated aging, those who have the history of surgical interventions like hysterectomy, hormonal therapies, chromosomal abnormalities, etc., may cause accelerated aging, and that also leads to dementia. Then the least but not the last, the idiopathic dementia, as the name says, where we couldn't find any clue that leads to dementia. Now we can let's move to the signs and symptoms of the dementia. Mainly, this is a cognitive disorder, but the sensory and motor functions will involve in later stages of dementia. So generally, we can classify it into cognitive and psychological changes. So the symptoms means the cognitive symptoms means the recent memory loss and forgetfulness, difficulty to undertake even simple and routine tasks, thinking errors, inability to find articles, often mood elevation fluctuations, sudden changes in personality or behavior, lack of motivation, communication problems, disorientation, poor judgment. Then specifically coming to cognitive symptoms, we can say it as confusion and disorientation, memory loss, which is usually noticed by someone else. Then difficulty to communication or finding with, that is, we can in medically we can say this dysarthria. Then difficulty with visual and special abilities such as getting lost while driving, even we forget about the route we want to drive. Then difficulty reasoning or problem solving, handling complex tasks, difficulty with planning and organizing. Then obviously coordination and motor functions. And the psychological signs and symptoms mainly include personality changes, depressions, anxiety, inappropriate behavior, paranoia, agitation, hallucinations. Now, I will detail you how the progress of the symptom, like stage wise. So in early stage, the early stage of dementia is often overlooked because the onset is gradual. Common symptoms may include forgetfulness, losing track of the time, becoming lost in familiar places. But while coming to the middle stages, as dementia progresses to middle stages, the signs and symptoms become clear and may include becoming forgetful to recent events and people's names, confused while at home, having increasing difficulty with communication, needing help with personal care, experiencing behavioral changes, including wandering and repeated questioning. And while coming to the late stage of dementia is one of the near total dependence and inactivity. Memory disturbances are serious and the physical signs and symptoms become more obvious and may include become unaware of time and place, having difficulty recognizing relatives and friends, having an increasing need for assisted self-care, having difficulty walking, imbalance during walking, turning difficulty, experiencing behavior change that may escalate and include aggression. Now, I'm talking about 20 minutes about the dementia. Now I am going to tell about how we can manage or how we are managing or what is our objectives in the management of dementia. Mainly 4 points. Let me see. Arrest further degeneration. As I mentioned earlier, this is a brain degenerative disease. So we have to arrest the further degeneration of the brain cells to control the progression of dementia. If we control or if we arrest the further degeneration of the brain cells, definitely we can improvise or we can better the quality of life, the quality of daily activities of the patient. And the third point is longevity. By providing a better health, we can extend the lifespan of the patient. And regeneration of cells in possible cases. This is not applicable in all cases. If the patient is below 40 years of age, generally the dementia, we all know, it's a geriatric disease and it will come after 60 years of time. That is the old data. Now the patients even below 40 or 30 years of age are complaining with dementia. So in that cases, we can try to regenerate the cells in possible cases. Now coming to our approach. What is our approach in dementia? We can control or stop the progression of the disease by arresting further degeneration of the brain cells with the Ayurvedic medicines and therapies. This is the most important approach. Ayurvedic therapies contribute to stimulating the nervous system, especially the brain, and thus improving cognitive functions of the patient. What is our uniqueness in the management or the treatment protocol of dementia? Authenticity in medicines. That means we are privileged to have a GMP and ISO certified medicine manufacturing unit, which enables us to make customized and herbal formulations as per each patient's requirement, which is very important in the treatment or the management of dementia. Personalized customization therapies are molded to suit each and every patient. Not only the patient, but also the ailments. Then the next is the most important, the integration. At VIAMS, the traditional and personalized Ayurvedic treatment is incorporated with allied healthcare techniques, yoga, physiotherapy, psychotherapy, audiology, speech therapy, nutrition, dietetics, which I will explain detail later in the session. And faultless approach, we keep a 360-degree focus on patients and their symptoms, by which we can also manage all related conditions. And the legacy, a rich and splendid healthcare tradition spanning 4 generations. After the objective approach and uniqueness, I would like to share about the methodology, what we are following. Mainly the 5 methodologies, that is the analysis, investigations, differential diagnosis, and defining treatment protocol. I would like to share more about the methodology of VIAMS. Analysis, visual, physical, Q&A. The most important and effective analysis is the interaction with the patient, especially in any type of neurodegenerative cases, which states in Ayurveda as Darshana Sparshana Prashnehi Pariksheda Charoginam Rogam Nidana Pragrupa Lekshano Ubasayaptibi, which is visual analysis, Darshana Pariksha, which includes observation and inspecting a patient's skin, behavior, hair, eyes, tongue, etc. The next is physical analysis, Sparshana Pariksha, physical examination such as Nadi Pariksha, that is the pulse diagnostics, palpation, percussion, and auscultation methods. The next is Prashna Pariksha, that is the question and answer session, where the patient is asked about the symptoms, the medical history, the lifestyle, the habits, and other important factors preceding or associated with a particular health problem. Coming to investigations, what are the investigations available for the dementia? CT scan, MRI scan of the brain, MR angiography, vitamin B12, vitamin D, TFT, then diabetes profiles, kidney profile, electrolytes, etc. are the available investigations nowadays. Now, in my experience, the patients come and say, Doctor, I am having dementia. Doctor, I am having Parkinson's disease. Doctor, I am having so and so. So I will tell the patient, okay, leave it. You just tell me about your problems or your concerns, what you're facing, what are the difficulties you are facing. So the differential diagnosis is most important in treating neurodegenerative diseases, because the patients may be misled with some diagnosis. So here, differential diagnosis involves distinguishing a particular disease or condition from others that present with similar clinical features. This dementia, there are a lot of signs and symptoms I had mentioned earlier. And that is similar in Parkinsonism, Alzheimer's, PSP, XDP, dystonia, multiple system atrophy, motor neuron diseases, amyotrophic lateral sclerosis, different types of ataxias, OPCA, oligopontocerebellar atrophy, that is, then chorea, tics, writer's cramp, etc. So differential diagnosis is the most important. After differential diagnosis, come to the diagnosis part. If the cognitive and psychological symptoms are present, we can diagnose it as dementia. Coming to cognitive, the mental decline, confusion especially in evening hours, disorientation, inability to speak or understand language, making things up, mental confusions or ability to recognize common things. These are the cognitive symptoms in a dementia patient. Coming to the behavioral symptoms, irritability, personality changes, restlessness, lack of restraint, or wandering and getting lost. These are the behavioral symptoms. And coming to the mood, anxiety, loneliness, mood swings or nervousness. Psychological will be depression, hallucination, paranoia. And muscular symptoms include that we can say as motor symptoms, which includes inability to combine muscle movements or unsteady walking. Also, in common, memory loss, falling, jumbled speech, and sleep disorders, including nightmares. Now, coming to the defining treatment protocol. The treatment protocol is individualized as per the condition and nature of the patient and the progression of the disease. Key treatment protocols include internal medicines, external therapies, and allied healthcare techniques. I'm not detailing about the internal medicine and external therapies as this session is not for Ayurvedic professionals. This session is mainly to spread the awareness of dementia and to propagate Ayurveda. So I'm not detailing about the names of the internal medicines and external therapies. Anyway, internal therapies, which include decoctions, medicated oils, ghees, herbal powders, tablets, customized metal and mineral preparations, etc. These internal medicines are aimed at improving nerves, muscles, and brain cells strength, cognitive ability, as well as the regeneration of the atrophied or degenerated cells of the brain. External therapies mainly include Ayurveda Panchakarma therapies meant for the purification and regeneration. It is known as Shodhana Chikitsa. And Panchakarma therapy will improve the muscle strength, tones, and bulk, as well as improving cognitive and sensory functions. Then integration of allied healthcare techniques. At VIAMS in our institute, traditional and personal Ayurvedic treatment is incorporated with allied healthcare techniques, which I'm going to detail in the coming slides. The most important and effective integration of allied healthcare science in the treatment or in the management of dementia is the integration of clinical psychology. Our clinical psychologist assesses the individuals, those who are affected with dementia, will help them to diagnose their cognitive, emotional, and behavioral disorders and treat using a variety of techniques, including cognitive behavioral therapy. Another important integration is the nutrition and dietetics. We have observed that absorption issues can be resolved with the help of a nutritionist. Dietitian assesses individuals' food and nutrient intake, their lifestyle and medical history. Their advice can contribute to improvement of dementia symptoms and increase health-related quality of life. Planning of a balanced diet based on periodical nutritional assessment is essential because dementia patients present with gastrointestinal dysfunction leading to constipation and gastroparesis, that is, food remaining in the stomach for a longer period than normal. So diet planning is also needed to maintain nutritional levels by avoiding weight loss or gain. The next integration is ASLP, audiologist and speech language pathologist. Had mentioned that speech problems will be made, monotonous sound, dysphagia, dysarthria. These problems, the ASLP specialist assesses, diagnoses, and treats speech language, social communication, cognitive communication, swallowing difficulties, hearing, and imbalance problems. And the integration of yoga and meditation. Yoga is the science gifted to the world by primordial Indian culture. Yoga aims to unify body and mind by combining respirational and physical exercises. Yoga enhances body movements, cognitive and behavioral problems. More than being a mere exercise regimen, yoga aims to coordinate bodily functions with that of the mind. Various yoga techniques helps in maintaining peace, confidence, and happiness to the mind while helping to increase flexibility, reduce muscle spasms, and ultimately leading to improved quality of life. Next, we are integrating the physiotherapy in the management of dementia. In the later stages of dementia, the patient will be having movement difficulties, then muscle tone problems, muscle stiffness, rigidity. Even some people may have like paralysis like problems, difficulty to move, especially in one leg. That is the commonly symptom seen in dementia. So we integrate the physiotherapy. So a regular physical exercise can be beneficial to maintain and improve more flexibility and strength, gait, and quality of life. Physiotherapy can help with the movement and balance problems. So we are moving to the concluding session of this session, awareness session, dementia awareness session. But this is very important. The mitigation and management, the VIAMS method. So how we are managing that I will tell you initially. Alleviation of exaggerated dosha with customized internal medications or formulations by cleansing the body with Panchakarma therapies. Psychology counseling, assess and treat emotional, mental, and behavioral problems. Nutritionist assesses and advise brain and CNS function, boosting nutrients and diet. ASLP specialist approach helps to assess and treat persons with speech, language, and hearing problems. Rekindling the vigor of body and mind through yoga and meditation, and improving the core muscular functioning and imbalance through physiotherapy. Now the mitigation. Dementia cannot be prevented, but the progression of the disease can be halted. Some of the measures to stop the disease progression include lifestyle modifications like be active as possible, dietary modifications. Dietary modification, that is, use all rice, wheat, citrus fruit, vegetables, nuts, milk products, pomegranate, lemon, mango, orange, guava, apple, peach, garlic, asafoetida product, etc. And avoid barley, aracanut, jamun, excessive protein diet, hot, spicy food, and incompatible food article. People who eat more fruits and vegetables, high fiber foods, fish, omega-3 rich oils, and who eat less red meat and dairy may have some protection against dementia. Antioxidants such as vitamin C and D are protective against the disease. Consumption of more vitamin B12 would be help people battling dementia. Calcium and vitamin D supplements help for bone health, as dementia patients have an elevated risk of developing fragile bones and fractures. Practice regular aerobic exercises. Environment modifications like avoiding exposure to harmful chemicals either at home or work. Consume antipsychotics or any other medications under close supervision of your doctor. Now, into the conclusion of the session. Dementia is a disorder with no established cure. Ayurveda has shown that it has a better success rate than other systems of medicines when dealing with any degenerative disorders. Similarly, it is considerable potential in dealing with neurodegenerative disorders is yet to be properly tapped. Dementia will affect the quality of life. Dementia patients' family members give extra help and support to stay and preserve their quality of life. At VIAMS in our institute, we aim to properly treat and document each of these cases with the ultimate aim of bringing Ayurveda into mainstream medical discussions. Yes, we can control dementia. Thank you. Sarve Santu Niramaya. Let all be healthy. Thank you. Thank you very much.